Hello there. My name is Sandeep Palikadetti, and I am a student at Wright State University's Boonshoft School of Medicine in my final year of Medicine and Public Health combined program. Today, I want to talk to you about how we, as future physicians and public health officials, believe that primary care and preventative medicine can revolutionize the state of our nation. As I've gone through my training, I've seen the agony and heartache of patients in their darkest hour. Seeing a middle-aged man having his foot amputated from complications of diabetes, or consoling a widow and her young children after seeing their husband and father pass away from a heart attack, begs the question, what could have been done to prevent this? At the heart of all of us in medicine or public service is a desire to see our family, friends, and neighbors lead happy, fulfilling lives. To be the purveyors of how their most basic need, health, is administered and delivered is a great responsibility and the calling of a lifetime. Many of you know the dire statistics. We have the highest per capita spending on healthcare in the world and rank 37th on the World Health Organization's list of healthcare systems and outcomes. 1% of the population accounts for over 30% of healthcare spending, whether it is during end-of-life care or expensive chronic disease management. Only 5% of healthcare spending is placed on prevention, while 95% goes towards acute care management. Our perverse incentive system rewards physicians for doing more rather than producing high-quality, low-cost outcomes. We reward heavily a procedure that saves someone's life rather than the upstream work of preventing the need for that intervention from arising in the first place. It is time for us to redefine how to think about health and well-being in this country. After all, if we reduce healthcare costs across the board, not only can our government allocate resources to other meaningful initiatives, and our private companies can be more competitive in a global market, but we will move towards a truly healthy and productive populace that can begin to solve the rest of the problems our world faces. The first issue that must be addressed if we are to redirect our focus on wellness rather than disease is how we are going to attract our young physicians into this field. Our statistics show that fewer and fewer young doctors are choosing primary care as a career path, whether this is due to lower pay, burgeoning medical school debt, or the lack of luster that is painted about this field when compared to the excitement of something like surgery or emergency medicine. It is clear that incentives must be offered and barriers must be removed. Programs like the National Health Service Corps are meaningful and necessary components of our society and need to be expanded. These programs provide much-needed medical care to vulnerable populations while also helping students crawl out from under the crushing debt that many of them face. Hopeful signs are seen by such proposals as Ohio House Bill 198, which will create scholarship opportunities for students who commit to practicing primary care. These kinds of inventive ideas need more attention. Payment reform is another issue that must also be adopted to show young doctors that they can support themselves and their families and pay off their debt in a reasonable amount of time if they choose a primary care field. It is encouraging to see agencies like CMS exploring this idea by proposing such concepts as the Comprehensive Primary Care Initiative, which will pay primary care doctors a global fee to take care of patients under a medical home type of model. By stressing the importance of things like coordinated care, health information technology, and high-quality standards, all in the context of a whole-person approach, this delivery system addresses many of the gaps of our current situation. It is essential that insurance companies, state payers, employers, and legislators continue to explore this and other ideas such as ACOs, bundled payments, and shared savings to better understand how tweaking our payment structure can lead to better outcomes and lower costs. I encourage those in charge of decision-making to continue funding these sorts of initiatives to show young physicians that there is hope on the horizon for primary care. Inspiring doctors to see themselves as citizens of the world rather than just one doctor treating one patient at a time behind closed doors is essential to changing our perception of healthcare in this country. I was fortunate enough to be enrolled in a cutting-edge dual degree program which helped me to understand the broader context of health, the system through which it is delivered, and the numerous social determinants that influence a person's well-being. This kind of education needs to be a core component of all basic medical curricula. Health truly touches everything, from environmental and natural resource protections to innovation and job creation in biotechnology and informatics, to basic social codes such as smoking in public places and wearing a seatbelt. The issue of health is integrated into every one of our lives. The end goal is to have a happy, productive society which is able and willing to keep this great machine advancing. The means to that end are discussed ad nauseum in today's charged political climate, but it is undeniable that our focus has been misplaced on the issue of health. I am not naive enough to believe that sweeping reform will happen overnight, but I am convicted enough to demand that we all use evidence and rationale in designing our systems. Ohio has been my home for almost my entire life, and it is exciting to see that we can be at the forefront of innovative change and creative thinking that crosses party lines and appeals to a greater ideology. I challenge you all to think about how primary care and preventative care can truly affect all areas of policy and continue to allocate resources towards projects that may bolster our citizens' ability to live the American dream. Thank you.